This ASH is huge for Insight because this has been a hugely productive year for us and our research collaborators. We have so much to tell everyone about. Actually, I'd like to start at last year's ASH because then we told everyone about our new antibody for mutant CALR. This is directed toward one of the driver mutations that we think starts MPNs in many patients. That drug is now in phase 1 clinical trials. Well, this year we are debuting another new drug that specifically targets the mutant JAK2, the V617F mutation. So this is the first time we've presented data on this drug, and we hope that it will go to phase 1 trials next year. So we have data on that. We also have updates on our ALK2 inhibitor, our BET inhibitor. We have new data, and many others have data of new agents in combination with ruxolitinib, our JAK inhibitor, which of course has been a standard of care for many years for appropriate patients with MF and PV. We have new data on how ruxolitinib is disease-modifying in MPNs. We have data on the natural history of MF and PV that we hope will help us better design new therapies and other people better design new therapies as well. And I'd also like to take just a minute to talk about graft versus host disease. Now, at this point, still the only proven curative therapy for MPNs is bone marrow or stem cell transplant. Graft versus host disease is a complication that can happen in people who have transplant, and it can be very debilitating and even fatal. Ruxolitinib has been a therapy that's been used in some patients with GVHD, and now we and our partner Syndax are really proud and privileged to have the #1 abstract in the plenary session this year for our drug axatilimab. This has a brand new mechanism of action, and we hope that these data will be submitted to health authorities soon to help bring this drug to patients who have GVHD after transplant. So a lot of new data, a lot to tell you about, but we've been working really hard, and of course we will continue to work hard for patients with MPNs.